and welcome to X-ray review. In this video we're going to look at Luigi Magione's lumbar X-ray. So please don't forget to like and subscribe, and let's take a look. So according to Magione's social media posts, he suffered from severe low back pain caused by a spondylolisthesis, and he told people he needed surgery and posted this photograph of his surgery on his X account. So there are two terms we need to look at first. Spondylolisthesis, which is an interruption of the pars interarticularis caused by a stress fracture during childhood or adolescence. And then we have a spondylolisthesis, which is used to describe any anterior displacement of a vertebral body in relation to the segment immediately below it. So in this example on screen, there's an anterolisthesis of L4 in relation to L5. And I have a whole video of the different types of spondylolistheses and characteristics that you can find linked in the description below. So when we look at Magione's X-rays, there's a few technical considerations. First being that there's no frontal view, so we're missing a lot of information in the absence of a frontal view. Second, we're looking at a photograph or a JPEG as opposed to a DICOM image, which would allow us to measure and manipulate the image. And in this particular example, it'd be nice to have a little better placement with the central ray and maybe get an L5, S1 lateral spot view or oblique views for better visualization. Either way, let's take a closer look at his lower lumbar spine. And we can identify L5 and the sacrum, and there is in fact a grade 1 anterolisthesis of L5 in relation to the sacrum, meaning L5 is anterior in relation to the sacrum. So some of the things that a radiologist is going to look for on an X-ray would be first the evaluation of the hardware placement. So are these screws in the right place? Is the hardware in the right place? Are there any fractures or anything like that? This inferior fixation screw appears to go through the anterior aspect of the sacrum. It's hard to tell whether or not these pedicle screws are adequately placed without additional views. And then you can also have things like hardware loosening, where you can get a loosened appearance surrounding the screws or hardware, and then things like infection, which aren't really seen in this case. If a patient is experiencing severe clinical symptoms, hard neurologic signs, loss of motor function, bowel bladder, or there's instability of that segment, then often stabilizing surgery is an option. In this case, they went with posterior lumbar interbody fusion, which are these pedicle screws and interconnecting rods you see posterior to the lumbar spine. There may be a replacement intervertebral disc, it's hard to tell, but what I noticed is there's no anterior lumbar interbody fusion, which in the bottom left-hand corner you can see that there's also screws anteriorly in this example. And typically, for better stabilization, you're looking at both anterior and posterior fusion. So notably, there's only posterior fusion in this case. So thank you for listening. Hopefully you enjoyed it. In conclusion, I would say that this hardware would be suboptimally placed, and it would be interesting to see advanced imaging and whether or not there's any fibrosis and things like that, which would lead to more clinical symptoms. But thank you again,